what your chief complaints are.
Chief complaint is like consistent low back stiffness and pain.
Where? Point.
It kind of starts like, I guess, here and just radiates down my leg, front and back. The first time I injured my back, I'm 26 now. First time I injured my back, I was 16.
What did you do that?
That was just like a muscle thing. Like I really strained my back, just between lifting weights and football practice, and I didn't really. Our medical staff was a medical staff, but it was more ran by the coaches than anything else. So I was kind of pushed back into practice really quickly. I think I took like 2 weeks off, but when I came back, I still couldn't even get down fully in like a 3-point stance.
Do you remember how you injured it? I know that's a while, 10 years ago, but...
Yeah, lift it the same way that it ended up happening again. Squatting. Doing back squats, just in the squat rack. I had weight on, going to warm up. I had like 135 on. And I got like right here, and it was just like, ugh, and I almost fell.
At 16?
Yeah, at 16. So when I was 19, I was playing lacrosse in college. Same thing, lifting for that. Same amount of weight in the squat rack. Go to do squats. This time, I just like fell to the ground. Need an MRI. They do the MRI. They realize I have a torn L4, L5S1.
Oh no.
But all they did for that was PT.
Okay. Well, so you have a torn. Did they use words like herniation or bulge?
They used slight tear and then spinal stenosis.
Yeah, they probably meant that you had an annular tear here in your disc. Okay. Mm-hmm. So the bones don't tear; they fracture.
Yeah, they
break.
fracture. Yeah.
But tear is usually referring to either like a ligament.
Mm-hmm.
But most likely it was an annular tear here is what they're talking about.
Okay. And even still, I got more attention from the collegiate staff, but it was like, okay, let's get you in PT, let's get you better, let's get you back on the field. Like, just get you back. It's never really been right.
Okay.
Since then.
That. When you were a teenager, did it go down the back of your leg?
That started.
Do you remember?
That started when I was 19. Yeah, the leg pain.
Okay.
I had to have pain injections because of that.
When was that done?
I was 21.
And what have you had anything done recently for it?
No. I just kind of, as you get older, your parents stop paying for stuff. So stuff's really expensive. So I just kind of ignore it, and it comes and goes.
Is it aching? Does it burn?
This past time it was aching, but it's aching, it's burning.
Does it shoot? Like a lightning type pain, or
not
or like a hot poker in the back of your leg.
It's been probably a couple years since I've experienced that.
You have experienced that.
Oh yeah, oh definitely.
And so they call this S1.
Mm-hmm.
All right. Here's L5, 4, 3, and then we count backwards from the bottom. Okay. So the bottom, you're saying the bottom 3 like that are injured, and it's probably just 2 discs that are injured. Mm-hmm. So it's 3 levels, but it's 2 discs. But it might have moved up. You're saying now you feel it on the front, right? Mm-hmm. So when somebody says on the front of their leg, now I'm thinking, okay, it's a little higher. We're probably at L3, and L4 is probably starting to give out now. The more recent the injury, sometimes the easier it is to get rid of. Sometimes the older ones are easier to get rid of. What I mean is to get rid of pain. The difference between being in excruciating pain and no pain is not that great of a difference in terms of size or distance. Here's what we would call like a herniated disc. It's come out of its sac. Bulging is just kind of like squeezing a balloon a little bit, and that's a bulge. But this is a herniation, which when they say tear, that means the jelly part inside the disc has actually torn through the fibers of the disc and is coming out through the sac. Okay. Now there's different grades of tear. Mm-hmm. You could have a tiny tear and not have really any symptoms.
Yeah.
Okay. Or you can have a massive. So they will grade that for you. Anyway, let's say worst case scenario, you have a herniation. Eventually, over the years, they dry up, and you get degeneration. It eventually fuses, and it stabilizes. That's the way it's supposed to be.
Okay.
I'll send people for like a consultation to a surgeon, and the surgeon says to me, he's not ready for surgery. Or we can do two things. We can operate on them, or we can just wait and it'll fuse itself and it'll stabilize.
Okay.
So you understand,
Yeah.
you're so young that to send you to surgery, I'd have to see if this doesn't help you at all, then I'd be like, okay, maybe we need to go seek a consultation. If this helps you like 10 to 50%, then I'd say let's continue on this track for a little bit.
Gotcha.
Okay. That's what goes on in my mind when I'm working on people. But the good thing is it should fuse, and that just takes years to fuse, and it stabilizes. But what happens is what's probably happening to you is that, guess what happens when these fuse down here and these stabilize, it moves up to the next level. You know, why is it never, it's not never, but why is it rarely up here? It's always these guys. If I had to place bets, I'd probably win 9 out of 10 on which level was herniated, because it's always L4, L5, L5, S1. Why? Okay, not just you, on everyone. Why? Because it's the most mobile segment, okay, according to the angle. C5, C6 down here is also the most herniated.
Okay.
And C6, C7, the bottom part. It's the part where all of the force is being applied and has the most motion. So we tend to use this more when we're children, where most of the problems occur is when we're children. Most of our injuries happen when we're little, before the age of 18. That's why people are like, why would you want to work on a young child? Well, that's when all of the injuries happen, even though they don't have symptoms then. Like the thing that happened to you at 16, you probably injured yourself at 8 to 12. And then finally at 16, you had the actual pain from it. Because like I was going to say before, this is no pain, excruciating pain. No pain,
So it's just
excruciating
when it
pain.
decides to just hit that nerve.
It doesn't take much. So that's why this works. Because all I have to do,
Smooth it.
just,
I gotcha.
okay. So people are like, you can't move a vertebra like that. You paralyze somebody. True, but I'm not moving it like you think I am.
Gotcha.
All I have to do is just, but is the problem really fixed? No. The problem takes, I'm not going to lie, this is going to take you to feel like good, if this works, is like a year. It's going to take you a year.
Well.
Now, the degenerated parts, some of it can't come back because it's lost that stem cell. It doesn't have it anymore to regenerate. The discs, once you blow out a disc, it's gone. It dries up though, and it stabilizes.
Gotcha.
Okay, so if I can get the disc, if you're going to do it actually yourself, I have to teach you how to do the exercises at home.
Okay.
Yeah, it's not really what you think. Let's get going. On your back, face up for me.
Okay.
This is what I gotta try to fix on him. Do you see how this foot is winged out more? Right, than this one? Okay. Can you lift your leg up, or does that hurt to lift that leg up? And down? Yep, and
Just gets tight when I do it. This side's way easier.
okay. Yeah, your whole pelvis, that right pelvic shift with rotation. Right at the base of the skull. I know. Ooh. Breathe, breathe. Wow. I know. What are you feeling?
It's a workout, but it's a good workout. I don't think my neck's ever been
Worked out like
worked
that?
out like this. Whew.
I mean, I take that tissue and give it about everything I got on somebody like you, though. Yeah, they get to see my limits. There we go. There we go. Oh, all right. I'm going to get the rest of it when you're on your stomach.
Okay.
But right now,
Perfect.
I want that atlas to move. So here we go. I know. This is the nerve-wracking part. The neck is always like, oh, little baby one. Here we go again. Chin back for me. Now turn. I got you, though. I've got you.
Okay. Ooh.
I still gotta get this back piece in. Right here. There it is. And that's all that is. Okay. What is it now?
This right toe, I don't know if it's anything related to my low back, but it always pops and it feels like I can't ever get it to like move. It's really strange.
This one?
Yeah, like I'm sure you can. I can feel it, so I'm sure you can. It just feels like it needs to always crack, and I can never get it to crack. It's crazy.
I don't know.
I bet you can.
I don't know. Does that hurt when I do that though?
No. There it is. Holy crap! You did it. You did it.
Now let's see if we can't do this one. I know, it's kind of like I gotta mess with it first. Kind of sit here, traction.
It's like a workout.
Uh-huh. Look at the other ones.
Oh my.
Uh-oh, baby.
That's the loudest one.
I know.
Oh.
Oh dear.
I mean to take off the toe with the foot.
That's what you gotta do.
There we go. Reach overhead and grab the table for me. Hold on. Good. Relax, I've got you. Does this hurt your low back when I do this?
Nah. Ooh. Oh. Was that my ankle? What was that?
That was your ankle.
Oh.
That was like 4 of them there. Bunch of little pebbles in the feet.
Oh my gosh, my left ankle feels amazing.
Yeah, it should feel good now. Yeah, you had a bunch of them rocked out this way.
That was
I'm such a picker. Okay, pain in this leg when I do this?
tightens up my low back.
In your low back, okay. How about if I push, was that going to hurt it?
Nah.
It's just the knee joint. Okay. As long as you're okay. Okay. This is information. It tells me a lot about what you do, how you use your body, which sides are tight.
I type a lot.
These are awfully loose.
I crack my knuckles and fingers constantly.
Maybe we should have you do it then. Yeah, let's see how this side's a little bit more abused.
I am right-handed, so.
Yeah, this side's got a little bit more issues here. And you just pull them out. And relax, elbow. I got you.
Oh.
Here we go. Elbow again. Okay. How does it
I feel like kind of like I just woke up from a nap, kind of like lightheaded a little bit,
Okay.
maybe. I don't know how to explain it, to be honest.
People say, oh, I feel taller, or I feel... Okay, hands go right here on these pads.
Oh, there they are. Okay.
Let's see my shoulders pop.
Let go. Oh, dear. Oh, my. Oh,
Does that hurt real bad in there?
No, it's an area of like, oh my, that's there. Okay.
Well, see, this is really tight, and guess what? Your low back is loose. Has a lot of flexibility.
What?
Yeah, I know it feels tight in the low back because the muscles are spasming, but biomechanically, this is just tight in here.
I see, okay.
Okay, that's gonna be hard for me to adjust. You might see Dr. Mondragon's feet leave the ground. All right. Oh. Well, yeah, there it is. See if I can't influence it a little bit before I do a leg check. No. Does that hurt?
No, that side just felt like something wanted to
Pop?
The right side, yeah.
Oh, over here.
Yeah. Yeah.
See, this is the way you want to subluxate. And I'm kind of like, no. Come back this way. Okay. You have a left short, though, definitely. That stays short.
What?
This side is shorter than this side. It's shorter. It's not really shorter. It's just up higher, translated higher when I'm looking at it. And then when I take it, if it was a posterior ilium, which is what I thought it was, it would have gone slightly long. But it stays short. So what that means is we have sacral deviation and pelvic deviation on this side. Take this arm behind your back for me. Just place it anywhere there. Perfect. That fixed it. Still short. Still short. Now watch when I come up. Now they're level with the arm behind his back. Okay? Then you can put your hand down. Now that tells me, okay, I need to clear out this region first before I try to analyze the pelvis. Okay, because there's something going on here.
Ooh.
You understand that's affecting
Let's
this.
see. Okay.
Not necessarily pelvic. So I'm like, wait a second. You know, that's what goes through my head. And then watch, we can do this side. To take this arm behind your back. That almost. There we go. And that just makes it way worse. His left leg is really, really short now. And it just makes the whole problem worse. So go ahead and arm down. Deep breath in. All the way out. Yeah, you got this shoulder here.
Oh.
Yeah, that wasn't that hard at all. All right, deep breath in. All the way out. Here we go. And
Oh, God.
oh, man. Breathe. Take a deep breath in again. And all the way out. I don't know if these are gonna go. There it is. Got one over here. No. So real sore right here, huh?
Yeah, oh yeah.
Yeah, okay. So,
Oh, yeah.
So before I can get that one completely, even though it moved, I'm gonna do some of the roller.
Oh, Jesus, oh, Jesus, oh, Jesus.
You're fine. Is that what you're saying to yourself?
Yeah.
Oh, Jesus.
Oh,
Ticklish?
nervousness.
Is it really that bad up here, huh? Too much? Too much?
No, it's fine. I'm just,
Breathing through it?
yeah. Mm-hmm.
Okay, let me work up to it.
Yeah. Mm-hmm.
But do you understand, this is so tight. I know you thought the problem was in here. It is, technically, but this is the worn out piece.
I got you.
Why did it wear out? Because this isn't moving. It's not contributing to the range of motion of your spine. That's why you're so sore.
Oh, man.
You got it. Breathe. There's a huge knot there.
Mm-hmm. Oh, God. Dear Jesus. Oh.
That's a huge knot.
Uh-huh. Mm.
It's almost gone. One more. I just check it. Is this as painful as the other side?
No.
That's what I'm
Well,
saying.
Now it's getting
Well, I'm
there
going on the
when
side.
you go over there, yeah. Oh, dear Lord. What do you got there? Oh, man.
Just one scar upon another scar.
Oh, God. Oh, dear Jesus. Oh. Mm.
So I spoke too soon.
Mm-hmm. Yeah.
Here's the piriformis muscle. That traps the sciatic nerve.
Jesus.
Any pain going down your leg?
No, it's just like...
Just
yeah.
right there where I am.
Yeah.
Okay. Right here. This is an important nerve. Right here on him. Yeah, you need to watch this one. Piriformis muscle connects like this, okay, to his hip, to the sacrum, to the hip here, okay. So you got to come in here.
Oh, Lord.
Sciatic nerve runs right through there. And that can give him the symptoms of pain down his leg. So I kind of come through here where the piriformis is and just take it down.
Oh.
Just like that.
Whew.
And go down to the hip.
Oh.
So we don't have a knot anymore. Because if I do this lightly, this is not doing anything for you. Do you understand?
Yeah, no, I understand.
I'm just
Ignore my noise. You're doing great.
Okay. I'm just like, you're not suffering in vain. Trust
No.
me.
All worth it.
Here we go.
Oh, man.
If you want to get in the gym, we got to go through these.
Yep.
Here we go. And after you go to the gym and work out, you have to have this done again.
Okay.
You're like, yeah, fine, baby.
Yeah, let's just...
Get your wife to work.
Oh, man.
You got to roll down the back of the legs, calves. I always kind of guard myself a little bit. So you're like, oh, I have big calves. You'll never get through them. So I got weapons.
That's right.
What are you talking about? I'm sure 150 pounds is enough. Breathe. Breathe. This is a horrible one. Okay, it's horrible. It's probably the worst right here. Really want to torture somebody.
Oh,
Tell them
dear God.
they have a problem right here.
Oh,
I
my
get
Lord.
mad at him. I'm like, you know what?
Let's
need-
roll your calves.
Right.
No, this is as bad as I remember. When I would get calf cramps, they would want to, like,
Oh, he got a cramp the other night, and
just yank on them.
it sounded like he was giving birth. It woke me up.
Oh.
I said, Matthew, I thought somebody was in the house.
Just stand up. Just stand up. I can't
He's on the
stand
bathroom
up.
floor.
So is this your thumb? Or?
Yeah.
I couldn't tell. I couldn't tell.
It's my thumb. I told you.
Oh.
It's a process.
Oh.
Okay. Breathe, because here comes a bad one.
Okay.
One more. I didn't quite get it all.
Oh, Daddy. Whew.
Just for good measure, let's take it sideways again. There it is.
Yeah, let's keep it.
Whew.
Before we finish them off. So here's the good side. The good side.
Ugh.
Come on, leg.
Oh, dear. Oh, dear.
Let me find it.
Whoa.
Breathe. We can't numb you for these.
That's fine.
Wrong kind of doctor. Here we go. Okay. Final one. That's it. I'm right on the sciatic nerve. Come on.
Oh,
Whew.
I kind of like felt that in like the front part of my thigh.
Interesting.
That was.
Well, as I get to the lateral aspect, it will go down to the front. When I'm back here, it's more of the back of the leg. When I'm out to the side, it's the front. Okay, so when I use the scraper on you, that's just getting that first centimeter of flesh. The star is like probably a good inch or two in there. So I'm going through different levels of tissue. Okay. The adjustment is probably the deepest. And then the star and my elbow are probably medium grade, let's say. And the scraper is just along the surface. And I already did some of the scraping on him. He's good. Not too much BTKA came out. Ooh.
Oh my God.
I know, lovely little trigger point there. See what I missed. I gave you a break. I'm coming back to it. See, that shoulder isn't flexible. We gotta make it flexible.
Oh my gosh.
Ooh. Okay, let's check it. Let me check that other piece.
Oh.
You're gonna be sore tomorrow. Lots of water, okay? Lots of water.
Lots of water, got it.
Yeah, go ahead and just walk around a little bit. Look a little better in your low back.
Yeah, definitely.
I haven't cracked it yet. I know, and you got sinus issues. Okay, I know right now you kind of feel off balance a little bit.
Yeah.
Yeah, on your side facing me.
Okay.
Here we go.
So, side facing.
Yep.
Okay.
Yep, this one bent. Good. Now I'm gonna roll you towards me.
Okay.
Roll. You're not gonna fall. Now your head, yep, you're off the table a little bit. Okay, I'm gonna have to go 100 times more. How does that, is that hurt though,
You're good,
your
you're
low
good.
back? Are you sure? You gotta roll towards me, like almost like you're gonna fall off, but you're not, because I've got your shoulder. Right here, there it is. That's what I think I'm gonna get out of it. I can do a harder move, I'm just debating whether to or not. How's the back doing still? Still
good.
fine.
You're good.
Okay, here we go then. That's all I got right there. Other side. Now you're gonna have to wing the leg back.
So like
Yes, yes. I know, you're not gonna fall, I promise. I've never lost one patient yet. I've come close. Oh man. See, this is what I'm talking about. Your hip is this wide. And I have to like jump to get up. So I have to jump and attack at the same time, okay? Here we go. You gotta straighten out the back leg if I'm gonna have any hope. Yeah, wing that back. I can't do it for you. Oh, there goes your knee.
Oh, like that. Okay.
Yeah, that's my leverage. I'm gonna spin you around your leg. Okay, here we go.
Oh,
Attack and jump.
that was something.
There we go. You all right?
Yeah, we're good.
Okay, one more.
Okay.
I got half of the sacrum.
Okay.
Here's the other half. Sorry, hon, you're gonna have to do it in pieces.
Oh, you're good.
This should feel a little better than the other one. I want it to come around this way. I got you.
Oh.
All right. And come on up. All right, while you're still alive, let me to your ears. Lean away from me. Lean.
Whoa. Oh. What the heck was that?
You haven't watched this part, I guess.
Maybe it's just been a minute and I forgot.
Lean away. Whole body.
Oh.
That side's okay.
Oh.
Yay! You said you had sinus problems, right?
Yeah, it like stuff like moved in here when you did that. That was weird. That was weird.
I know, that's the one everybody goes, but they heard nothing.
Yeah.
I know, you're just saying sinus issues, so I thought I'd work a little bit on it. Come in here, here's the frontal suture. Compress. Twist. I give the cranium an adjustment. On you, I'm gonna have to use. I always tell my patients, use the pinky side. On you, nope, thumb side. Here's the one I couldn't get when you were laying down.
Oh.
Look, I don't know if I want this one. I don't know if I signed up for this one. Okay, once it loosens up, I don't have to go anymore.
Oh my.
Hold on. Almost got it. Come on.
Gosh.
All right.
Oh man.
Once it goes, I know, I've got it. I'm sorry. Okay, exercises.
Okay, cool.
You're like, do I have to move? You place this right here in the middle of your back. Lay it all the way back. You're gonna feel stuff crack.
Oh my lord.
There you go. Bend your knees. It's a chiropractor and a roller. No. Pelvis has to be on the ground. Can you do it? Can you do it? Yes. Is it too much? No. Stay right there. Pelvis. Breathe. You need something for your neck? We'll take some of the pressure off.
Now we're good.
Let it open up. Pelvis is on the ground. Yeah, lower that down. Lower it down. That's what I'm saying. Let's put a pillow here. Look, we'll ease you down into it. Lift up your head. Lift up your shoulders. You got to get underneath there. I can't do it for you. That's it.
Oh, buddy.
Low back will feel like a pull. If you want to reach down and hold onto your legs, you can. No, like the top of your thighs. Yep, and push. Pelvis on the ground. Pelvis on the ground.
Gotcha.
Because if you lift your pelvis up, you round your low back. I don't want that. Here you go. You gotta let this open up.
Gotcha.
Breathe. We're in your mid back. There's nothing to break there. There's nothing that can happen to you, okay? It's just an intense stretch.
Yeah.
This is why we were having trouble. Now, the higher you move it, the easier it gets. So if you want to roll that way on it, go ahead. It gets easier. If that's just too intense. No?
If anything, that got a little bit more difficult.
Then keep going a little higher. Eventually. You see, you're really stuck in between your shoulder blades, though.
Yeah.
So, but it gets easier for the low back. Higher up you go. You've just got a bunch of busted ribs that have never been worked on. Like, you never work on them. So we're going to work on them today.
All right.
Okay. Yep. Right there. Stop right there. That's about as high as I want you to go. If you can, open up that chest. Just put the arms out like that. Yeah. Just drop it. That's it.
Every few seconds it gets a little easier. A little easier.
Then you try to come off of it. We'll walk you through that part too. All right, now how are you gonna get off this thing? You're gonna roll. So no sit-ups. You get to 15 degrees and you're like, I'm stuck. No, you're gonna roll. So roll. It feels like a knife, and you're done. Take a break. Take it easy.
Man, that was
Was it everything you thought it would be?
it was intense.
Traveling all the way over here.
Oh man.
Hopefully I did something for you.
Stuff feels moved and in different places.
Good.
Things that I didn't know were out of place. I didn't know anything about the ribs. I had no idea.
Yeah. Okay, turn for me. It's so much better though. You're standing straight.
I was about to say, I feel more like in control of myself instead of like cocked sideways.
Yeah. You're gonna need a few more of these. Like, we're gonna have to find you somebody, okay?
Yeah.
And then we will take it from there.
Okay.
All
Works.
right.
That works.
All right. We're good. It's recording. Yeah, Linnea ditched me.
Yeah, so like I just feel like more over myself instead of like, I don't know. I don't know if I looked it, but like I felt like when I came in here, everything was like trying to like turn to like this way.
Yeah.
And like when I would walk, I would feel like I would be like leading that way, kind of. And now I just feel like more over myself.
Oh, sorry, guys.
And like more in control.
Yeah, you're saying you feel more grounded, like
yeah,
into
like
the
my,
ground.
like my heels feel like they're in the ground more, like straight up, and I'm not, like I have more balance.
But now, see, when we did, do you feel how much of a difference do you feel after doing the roller versus the table? You know what I'm saying?
I was about to say the roller is what's, I think, what I'm feeling more than this.
I know.
Because when I was walking around after, I was like, well, I feel kind of lightheaded and like more loose, but now I feel like
open
and like over myself.
Yeah, because when the roller takes you back, that's what I was trying to explain to you. The whole point of this is so that I can take you backwards.
Gotcha.
Because people can't just go backwards cold. It takes all of that, so that's what I'm saying. Homework. You've got homework to do.
Okay.
Okay. I'm sorry, I got this
ready.
camera.
I'm ready.
I got the camera.